distinguished traditional medicine practitioners, phytomedicinal investors, other stakeholders, both here in present and those who are joining us virtually. You're all welcome to NIPRD. Let me begin by apologizing for coming late. It is not in our DNA to be late, even by 1 minute. I had initially secured the commitment of the leadership to be here in person, but those of you who are following national news saw what happened yesterday at the COVID conference, and as such, the ministers of the Federal Republic are mandated to be at the Presidential Steering Committee COVID conference in person. So whereas the initial plan was for my minister to start off here and then go and close the event there, based on a directive that changed yesterday, that was no longer possible. And once that was communicated to me, I had to begin to make my way here rather than to keep you all waiting. But you would have recognized that when I began my protocol, I mentioned my minister first. And that is to demonstrate to you all that even though Senator Dr. Olorunimbe Mamora is not here in person, he is here with us in spirit. And we could have no better political leader for this particular conference and this event today than Senator Dr. Olorunimbe Mamora, who has been a strident and committed advocate for the use of phytomedicines in improving access to health care for our people. So, on behalf of myself and my team, kindly accept the apologies for the 30 minutes that we were not here. Ladies and gentlemen, distinguished delegates, the conference that's been put together today, building capacity of traditional medicine practitioners in Nigeria, improving quality and stimulating investment, is arguably one of the most important workshops or conferences that you will attend in this decade. And I will tell you why. Before COVID-19, we had always pushed the envelope to say that phytomedicinal practitioners, people who are the custodians of traditional knowledge, people who have been the purveyors of healthcare for our people for centuries and for decades, cannot be left out of how we address our healthcare access in today's world. And for a very long time, people refused to listen to us. Until COVID-19 came and demonstrated to everybody that unless we begin to look inwards and begin to harness the potential and resources that God has given us, using the capacity of the ladies and gentlemen practitioners in this room, unless we begin to take expedient action in doing that and paying the type of seriousness that this particular intervention deserves, we as Africans will remain at the mercy of the rest of the world when it comes to taking care of our people. When we were putting through that argument, we told policymakers and key stakeholders at the highest levels that already the ladies and gentlemen in this room take care of the healthcare needs of about 70 to 80% of our population. Already, the ladies and gentlemen in this room have access to the thousands of plants that have ethnomedicinal and ethnopharmaceutical value. Already, the ladies and gentlemen in this room are employers of labor, and they are the grassroots of stimulating socio-economic development, particularly in areas of job creation, capacity building, and revenue generation. And you don't need to take my words for it. These are engagements that were made in private, but for posterity's sake, we also made press conferences and we put out statements in the media, and these arguments are out there for you to validate using the internet. But for decades, nobody listened to us until COVID came, and we got to a point where if vaccines are manufactured in England, they will not even agree to export the vaccines to France, who literally is 30 kilometers down the road. Talk less of sending it to Africa. And the same thing happened in India. There was a time India stopped the export of active pharmaceutical ingredients to the rest of the world. And India and China collectively represent about 70 to 80% of active pharmaceutical ingredients. So it became clear to everybody that the argument we have been making for decades is the truth and must be engaged with. And so during the past 24 months, there has been a flurry of attention in this area. During the past 24 months, TED Fund, who previously did not agree to fund non-government tertiary institutions, based on this and similar arguments, opened up their doors, and they have now given NIPRD and its partners $250 million to improve access in this area. In the same time, Afrexim Bank, who previously did not used to fund institutions like us, opened their doors for us to build capacity in APIs, and they've given NIPRD $400,000 to do that. In the same time, ECOWAS, who previously did not used to fund clinical trials for phytomedicines, also opened their doors, and they've given us thousands of dollars to begin work in that area. And we said, yes, NIPRD is a world acknowledged leader in this area, but NIPRD cannot do it alone. Without the ladies and gentlemen practitioners seated in this room, if NIPRD moves forward, all we will be doing is developing interventions which will cater to a small proportion of Nigerians. We must also make sure that the ladies and gentlemen practitioners in this room, who are the grassroots practitioners, those who deal day in, day out with the patients and day in, day out with the plants, must also be carried along. And I am indeed grateful to the efforts that Professor Jemilat Ibrahim and her team have made in bringing this to bear. But also, I want to reserve my most profound gratitude to the World Health Organization for making this possible. Because the truth of the matter is, we conceptualized this a long time ago. And when we asked for the true value of this particular workshop to be paid by participants, it was not possible. And the WHO under the leadership of the country representative, but specifically based on the strident commitment by pharmacist Hamzat, who is seated here with us today. That is why this is possible today. And so, ladies and gentlemen, I know that by the nature of your work, by the nature of long hours you spend in your medicinal gardens, in the forest, communing with your ancestors, reflecting, documenting, and developing innovative formulations, the time you take with your patients, the care you put into your practices, I know you're all very serious people. So the next statement I'm going to make, I am sure you already know it, but I will still make it. The value of the training you're receiving today, if you go to the open market, you cannot get it for 250,000 naira a piece. You cannot get it. So I would urge you to recognize the value. There is nobody who is speaking to you today who is not a world-class researcher. Many of them are professors of world repute. Many of them are multidisciplinary PhDs. Many of the directors seated here representing their DGs are world-class authorities, and they have all left their assignments to be here with you today. So I just want to re-emphasize that that is the value of the training that you're receiving here. Two things you need to take away from the training. One is quality. The National Institute for Pharmaceutical Research and Development is a world-class authority in the development and production of quality phytomedicines. And I'm not saying it because I'm the Director General. I am saying it because the evidence says so. We're the first in this part of the world to gain both the ISO 9001 and the ISO 17025 certifications. For those of you who are not very familiar with that terminology, those certifications basically mean that when we bring our results and our output here, everybody in the world recognizes it without any prevarication. As I speak to you in Nigeria, I think it's only 2 government institutions that have those 2 certifications. NIPRD, who got it first, and our junior sister, NAFDAC, who got it after us. Secondly, NIPRD has been acknowledged center of excellence by world-class bodies, such as the bodies affiliated with the WHO, African Union, and ECOWAS. And when bodies affiliated to those multilateral bodies call you a center of excellence, you must have done, and they would have validated processes to ensure that you can wear that badge. Thirdly, is that NIPRD was the first institute to take a phytomedicine from drug development all the way to phase 2 clinical trials in the area of sickle cell anemia. That particular product was registered by the FDA in America, and there is evidence that it is in use in over 40 countries across the world. And just like the presenter mentioned earlier on, the practitioner who brought that formula to NIPRD still has a representation in the intellectual property of that particular formulation. So even during COVID, NIPRD was the first to undertake a categorical analysis on the COVID organics preparation. And our results on that particular formulation was announced both by the Minister of Health and the Secretary to the Government of the Federation. That result went viral in both English and French, and you don't need to take my word for it. You can go online and validate what I have said. Professor Ibrahim, is she in the room? Okay, yes. How many publications have we gotten out of that so far? I think 2 or 3. 2 publications from that. So the evidence is there online. And so we are not just big talkers in NIPRD, we are also big doers. And in the spirit of my administration, we are here to share knowledge. Because if only NIPRD has the capacity, we can go only so far. But if we share knowledge with the 100 of you who are here in person and who are joining us virtually, it means that we have 100 mini NIPRDs across the country doing the same thing. And so that is what I have to say about quality. Take the presentation seriously. Professor Ibrahim, I hope we have booklets for them to go away with. They're taking away all the presentations. Very good. The lead has authorized that all the presentations be shared with you. So if they're moving too fast, don't worry. You can go home and go over the presentations again. We have a very, very robust and interactive consultancy unit who is ready to engage further with you regarding any specifics that may come out from this particular workshop. So that is what you need to take away in terms of quality. The second thematic area I want you to pay attention to is investment. Currently, I'm not sure that any of you here has more than 100 patients or clients. If you have more than, if you're a phytomedicinal practitioner or a traditional medicine practitioner here in the room, and you have more than 100 patients, please put up your hand. Okay. Oh, very good. If you have more than 1,000, please put up your hand. Okay. If you have more than 5,000, please put up your hand. Aha. Okay, so one person has more than 5,000. Part of the processes that we will put here today, particularly the process on NAFDAC registration, the processes surrounding formulation innovation, are processes that will enable you move from having 5,000 patients to having 5 million patients. Because what it means is that whilst you are currently limited to maybe your geographical area, and when I say your geographical area, I'm talking about maybe your state or your country. The processes which will be detailed to you during this conference will enable you to go international. I mentioned to you that our product, there is evidence that is being used in over 40 countries. Since I became DG, at least people from 10 different countries have called me to say, send me Niclovix. So that is what the processes will do for you. And when you have this particular increase in market, what it means is that you can now go from a sole proprietorship to a limited liability company, or from a limited liability company to a public quoted company. There are at least 3 or 4 pharmaceutical companies I know who have phytomedicinal products in their profiles and are listed in the stock exchange. So these are the building blocks for you to begin to look at getting increased investment in your practice. So, and I think the organizers have done very well. As you can see, the title of the conference is, why are you calling it TMP Training Workshop? This is not a workshop. Do you feel like you're in a workshop? It's a conference. Professor Ibrahim, let us brand. I've been to conferences in UK that are not as elegant and as sophisticated as this. So the theme of the conference, Herbal Medicines Production in Nigeria, Improving Quality and Stimulating Investment. I cannot think of any better phrased theme for this conference. And so, ladies and gentlemen, without further ado, everybody here, my people, not everybody, my staff here know that I have a very limited word count, daily word count. I think it's 1,800. And I've already exceeded my daily word count by about 15. So I hope that if you do not take any message away from this conference today, take away the message that I must ensure that my 250,000 naira is utilized for me to better understand how to improve the quality of my product and consequently build a framework for improved investment. Ladies and gentlemen, I thank you very much for your attention.